Right, we are live. Good evening, everybody. Good evening, good evening, good evening. Good evening, everybody. Good evening, good evening. Thank you for joining us. Give everybody a second to get here and we will get started. Won't keep you guys too long on your Friday evening. Good evening. Good evening, good evening, good evening, Miss Wolford. Good evening. Thank you. Yeah, the afro. Gonna have a little fro for a while. But thank you so much. Thank you. It's been a long time since I had a fro. I had a fro in seventh grade before I had braids. Good evening for all those who are just joining us. We're just chatting it up a little bit before we get started. But it's been a long time since I had a fro. Give people a few more seconds to get with us here before we get started. Hope everyone's being safe on this Friday. It's going to enjoy yourselves a little bit this weekend while being safe. Thank you. Thank you. I appreciate that. Thank you so much. Thank you. We're going to give everybody another minute to join us and then we're going to get started. Everybody. All right. Woo. See, we got folks from all over here today. So thank you for always, as always. You can start sending your questions in as early as now, so we can make sure that we get those answered for you. We are going to go ahead and get started. Thank you for joining us on today, April 17th, for another briefing with Council President Brandon Scott involving COVID. No special guest today, just me, everybody. We're going to try to give you a weekend cap of what's going on. Start off by, as always, giving you the latest totals. We're now up to 11,752 cases of COVID-19 in Maryland, 425 deaths statewide. Baltimore City now has 1,273 out of those cases, and 38 out of the deaths in COVID have been in Baltimore. So, just a reminder to everyone, as always, please take COVID very seriously. We can see the impact that it's having here in Baltimore, in particular zip codes, but also across the state of Maryland. Make sure that we are taking it seriously, practicing social distancing, wearing your mask, wearing a facial covering, doing everything that you can do to stay safe in this time. So, some big updates today from Governor Hogan. We'll need to make sure that we're taking everything into consideration and every single precaution. Face covering mandate for the state of Maryland goes into effect 7 a.m. tomorrow. 7 a.m. tomorrow. Remember, if you don't have access to a mask, you can be sure to cover that yourself with some kind of fabric, a bandana. We posted videos and links on our social media pages of how you can make one at home. We're going to all have to be creative. We should probably have a contest about who can come up with the most creative Baltimore-centric COVID-19 protection mask, but make sure that we are following that tomorrow. Governor also announced today, big news today, that schools will remain closed until at least May the 15th. So we will continue digital learning until then. We will also continue to make sure that you have access to what's going on with digital learning, making sure that our students and our parents know where they can see, get the packets, and even get the laptops and things that the system is handing out. The governor talked about today, when the state will reopen. This is something that we hear consistently from you guys on these each and every night. And the things, many of the things, as you guys know, that I've been talking to you about consistently, right? Testing capacity must increase. Hospital surge preparedness must increase. robust contract tracing from COVID must increase, an increase in PPE, and a 14-day consistent decline of cases. The state of Maryland will not open. That is the barometer that is setting for the state of Maryland to reopen. Just a reminder, please, everyone, send your questions in, your COVID-related questions, all your questions that you have over. Also, just want to spend some good time breaking down the mask, right? The facial covering and what folks are advised to do and what we should be doing. First and foremost, let me remind you, as this was something that I pushed for last Monday, we had the council unanimously support it, then had the mayor and governor say on Wednesday following that they were putting it in place for the city and now the state of Maryland. First and foremost, I didn't do that just out of the mind of my own. That was based on CDC guidance and CDC guidelines, right? And this is what we have to follow. So now that you know that you're out, you have to be required to do that when you're in essential businesses. That is the guidelines from the health professionals, and that's what we should be doing. Everybody is advised to do that. Everybody should be doing that when they're out in the community, and especially when social distancing measures are not possible. When you're in the store, when you're doing all these things, make sure that you're covering your face, again, with a mask. If you don't have a mask, there are ways for you to do that with fabric and all these other things as well. Also, if you live like in an apartment and someone's coming to work on your house, or even at home, if someone's coming to do work in your home, or your heat, your air conditioning, your sink, plumbing, whatever, make sure that those individuals are wearing masks, and that you should also be covering yourself even when, like, the delivery man. I know a lot of y'all are using Grubhub and Uber Eats and all of that. When you're interacting with those people, you should be covering your face just as if you were in the store. That's critically important to slow down the spread of COVID, because they're interacting with a lot of people every day, and we know they're trying to protect themselves, but we also know how this virus works, and we have to make sure that we're protecting ourselves in every way possible. Also, based on this, employers are to develop policies on face covering. All public and private employers are being directed to develop internal policies around the use of face coverings to promote health and safety of the workforce. Someone sent us a message about the fact that fast food establishments are not requiring their workers to wear face covering. This new mandate will address that, and if you see that workers are continually not doing that, please let us know so that we can try to have that addressed. And according to the CDC, going to give you the CDC guidelines again. According to the CDC, facial coverings and masks should fit snugly but comfortably against the side of the face, be secured with ties or loops, include multiple layers of fabric, allow for breathing without restriction, and be able to be laundered or machine dried without damage to the content or the shape, changing the shape. You can always find more guidance about that at cdc.gov. Also want to remind everyone about our COVID resource map. Thank you. Many, now almost 30,000 people have actually used the COVID resource map. Is again available at bit.ly/bemorecovidmap. Has all the special shopping things for seniors and on there, the supermarket hours, youth food sites, schools and rec and parks, healthcare clinics for people who are uninsured. All of that information is there. And now I'm going to take a beat and see what kind of questions you guys have today. And please be sure, if you have more, make sure that you get them in. Let's see. Does Baltimore have rapid testing sites for COVID-19 for the general public? No. And I think this is critical. I actually sent a letter to our health commissioner and the mayor and some other folks earlier this week talking about just about that, right? Just about that. And this is what the governor was talking about today too. Listen, nowhere in the country has testing that they need to be able to test everybody. Right now, testing is still very, very limited, and it's people that are getting. You have to have a doctor's note in order to get a test. But as we move forward with this, we're going to have to be able to do that contract tracing and rapid testing, especially in areas and neighborhoods where we see a lot of people contracting it, and when you're having these outbreaks in small pockets like that. This is something that we're going to continue to push forward, that I'm going to continue to advocate for, so that we can actually move forward and be coming back and from this in a responsible way that keeps us all healthy and safe. So someone asked a question about the center downtown as a partnership with the state and the city. Is a partnership? Listen, the truth is, with times like this, these emergency funds and things that were put out, most, if not all of that, is going to be recouped through the federal government anyway. But when you have a great partnership with the state and other folks, this of course is there. They haven't had to use so much of it, because we've done a great job, and you guys have done a great job of listening and adhering to the advice that we have been given. So thank you for that question as well. So someone said, don't have a doctor's note or insurance? Again, we if you go to our COVID map, bit.ly/be more COVID map, it lists all the health clinics around the city of Baltimore that will offer medical advice to those who don't have insurance. That way you go to them, and again, let me back this up. If you have the very severe symptoms, right, that's when you should, if you have a doctor, seek out your doctor, seek out their advice. They will walk you through how you should deal with COVID-19 or your symptoms of COVID-19, and going to the doctor, going to the hospital, going to one of the testing sites. Our testing site at Pimlico, you need a doctor's note. That's ran by the health department. You need a doctor's note, and you can get that from one of the sites that we have mentioned on our COVID map, and that's bit.ly/be more COVID map. bit.ly/be more COVID map. That's a great question. Other questions today? Other questions? Let's see. And then this is another thing that continuously comes up. Folks asking, when are we going to reopen? The answer is that we don't know. We have to look again. You have to have significant, consistent 2-week drop in cases going down. We need to see that first before things we can consider reopening, because we have to understand, and also understand that everyone, this is a possibility that we could see a drop in the virus and then come back, right? It could come back. So just understand that even when things reopen, they're not going to be the same. It's not gonna be a flip of a switch and you're gonna go back and boom, it's gonna be August and the Ravens games are gonna come and the stadium's gonna be full. It's not gonna happen. A guy that I'm friends with, the mayor of Los Angeles, Mayor Carcetti, said the other day that there will be no large concerts or gatherings or sporting events in Los Angeles until 2021. Understand that the world as we know it has changed, and we're going to have to follow public health advice on how we're doing that. Is it mandatory to wear mask and facial coverings outside? Again, you have a mandate from the governor starting 7 a.m. tomorrow when you are conducting essential activities and you're not on your own property to have facial covering or mask. Great question. Someone said, will they eventually test every zip code in Maryland to get a more accurate number, plus probably a lot of people asymptomatic who are carriers? And that's the asymptomatic thing, and thank you, Steve, for bringing that up. It's something that's so critical. That's why I tell people, even if you're feeling good, don't go to your parents' house. Don't go to your grandparents' house, because you could be carrying and never know. There are people walking around who never know. And Steve, to your point, again, that's why I am consistently pushing, and we know that everyone is at this local and state level, pushing up to the feds about how we can increase and have rapid testing so that we can test more people. We know if you look at the zip code map that there are people all over that have it. You can see it's hotter in some areas than others, but we also know that we need more tests so that we can have a more accurate picture, but not just the testing. The tracing is very key. If you're tracing back and seeing what happened, who they came in contact with, then you can help push this thing down. So do I think schools will be closed till June? I don't know, right? I think that they will make that decision at the state level. My gut tells me that that's the case, but I don't know, right? Because this is an ever changing and evolving situation, and we just have to stay in tune with it and see what's happening. But people should prepare to have to do distance learning, homeschool learning with the children for the rest of the year. Absolutely. Someone said, why can't you be tested a second time after testing positive? Uh, Listen, testing is very limited, and that's why they are putting in the restrictions that they have about doctors who can get tested, how they can get tested, so that they're testing people who may need that one test that's not going back to someone who's already tested positive could actually help save someone's life. And I think in a public health emergency, that's the most important thing. What else? Any other questions for anybody? Anybody else have any other questions today? Hope you guys got good plans. What are y'all planning to do this weekend? Everybody, fellas, I know all of y'all are going to be watching the Michael Jordan documentary on Sunday night, 9 o'clock. I know I sure will be. And for all the young brothers and everyone on here who has teenagers, right? Sons and daughters who think LeBron James is the greatest basketball player ever. Make sure that you force them to watch that documentary on Sunday night. Do I think sports will resume? I do think that eventually sports will resume. I know that they're having conversations on how to do that in a safe way. If you look at what happens across in China and other places, Taiwan, what they're doing with their baseball season, they're doing it in a way where there's no fans in the stands, and even some places their basketball, they're keeping all the teams in one particular place. Sports will resume, but it will not be the way that we are accustomed to at all. What about sanitation of the streets? So the DPW is still out picking up trash and all those things, cleaning those corner cans. If you think that's an issue in your neighborhood, send us a direct message. We can follow up with you directly. A documentary is coming on ESPN on Sunday night at 9 o'clock on ESPN. It's called The Last Dance. So apparently the Bulls and Jordan gave access to a documentary team way back in 1998 to film their last season. So it's a must watch for sure. Great question. Someone asked, when should we expect ballots for the mayor's election? We know they will be mailed out on May the 8th, so you'll get your mail-in ballot sometime right after May the 8th, so somewhere between May the 10th and 11th, and you can just plug that out, fill it out, put it right back in the mail. You don't have to take it in. You don't have to pay a stamp to do that. Great question. Any other questions tonight, everyone? I hope everyone's going to have a great and safe evening. Be mindful, as always, to practice social distancing, wear your mask, stay in tune for us with the latest information. Send us all your questions all the time. We greatly appreciate all the support and love you guys have given us, helping me. This has been helpful to me to make it through this tough time when I can't be out in the public as much, giving you guys this information face to face. Thank you all for tuning in. Make sure that you're sharing the information with everyone. So with that, we will see you tomorrow if they're up. Here we go. So great question. How do we get the information out to those like on Pennsylvania Avenue and others? We're going to be using credible messengers to do that. We're going to be targeting the neighborhoods in a culturally sensitive way as well, trying to use people that they will listen to and communicating every way. We know the NAACP Baltimore, shout out to President Little and all the members of NAACP Baltimore, has a truck going around playing loudspeaker, telling people to take this seriously from the NAACP, and we have to make sure that we are adhering to that advice, and we have to spread that information as much as possible. So has the wearing of face mask been proven to work? It's okay. Look, it's very simple, right? You know that if you have COVID-19, you've seen it that you can spread it. At first, they didn't think that this was the case. but when they continuously study the virus, they know that it reduces the ability for one fluids and things to go from one person to the next, covering you up. So we know that it will protect you. Follow the advice of the public health professionals. If you go to cdc.gov, you can see that, right? The person that you should not be listening to, again, is the president. Listen to the public health professionals who are trying to keep us safe. They are the ones who are leading this effort and should be leading this effort. When you are sick, you go to the doctor. You don't run to a lawyer. You don't run to a businessman when you're sick. You go to the doctor and say, "Doctor, what's wrong with me? How can I get it better?" All right. Thank you. So somebody said, when should you expect to hear back from unemployment? Listen, we know they're overburdened. We know actually the state of Maryland is actually hiring here in Baltimore to help people weed through that. We're just gonna have to be patient to this, patient about unemployment. Make sure if you send us a message, we can connect you with our partners in the state and try to see if we can see where you are in the process. So someone wanted to pose a question. Their job is receiving unemployment in a corporate account and told them they aren't. How can they get? You should have that person needs to reach out to us directly so we can follow up with them about their unemployment. All right. Well, thank you, everybody. Thank you for tuning in today. We'll see you again tomorrow. Thank you for joining us as always. Make sure that you stay safe, stay healthy, enjoy your weekend. Get your facial covering and your mask and everything. And be sure to tune in tomorrow. And we will see you tomorrow for another live update. Thank you.